So this is part three of questioning the question, hopefully maybe at some point answering the question, is gender affirming care ethical? What we've run into in the first two episodes is realizing, I think a lot of the tension around this topic comes from a divergence even of essential meaning. I think I've invoked this previously, but it reminds me of I believe it's a Winston Churchill quote of saying the Americans, the English are two peoples separated by a common language. And I feel like that pops up is a recurrent theme in a lot of the things we talk about here, but very specifically this one. I would say most especially the stickiest word of the run of words. I think ethics gets you into a relativist or absolutist argument, which is inevitable. But gender, more than any other word, seemed the sticking point. And we just saw yesterday, as when we record this, we're recording this on Tuesday. It'll go up tomorrow on Wednesday. But yesterday, an executive order was signed by freshly re-inaugurated or whatever inaugurated President Trump, and he did an executive order on day one and termed it this way, which I think is a little manipulative, but whatever. Defending women from gender ideology extremism and restoring biological truth to the federal government executive order, which essentially said that references to and assumptions of the accuracy of quote unquote gender identity were being abolished from federal use. There was even language in there to suggest that they're going to phase out the use of the word gender. So in some ways, the whole thing that we've spent, I don't know, hours trying to parse out, they're just like, let's just throw it away. It's tainted goods now. But essentially, asserting that there are two genders is the way it was phrased out loud. And then there are two genders and or two sexes, that those are seen as synonymous, but as an explicit semantic rejection of the synonymity of gender identity with gender slash sex, either of those terms as words, which is pretty fascinating. I don't know what your internal reaction in your cohort was like, but I saw some pretty consistent reactions on mine. But all of that to say, we're here on Totally Classic asking the questions that people suggest that maybe you won't be able to talk about if you disagree with someone else. These are cancelable conversations. But we're going to have them because we love each other and we're curious about it. And it's always, even if we can't find points of agreement, we can always find new ways of understanding one another. I'm Brendan McNamara.
And I'm Andy Swindler.
And this is part three of Is Gender Affirming Care Ethical?
First for us, three parts.
Yeah, this is our first three-parter. I thought we should just very quickly run through for people who either already forgot our episode from 2 weeks ago or 4 weeks ago, and just quickly retread whether we agreed on terms or not. I feel like we agreed on we agreed on. Uh, Affirming we agreed on. Meanings like does uh, does something exist? Is
Equivalency.
yeah, equivalency. Thank you. Agreed on that. Affirming, as in to come alongside an agreement with. I think we agreed on that one. Care. I think we have some flexibility on, but we generally look at that as perhaps an active form of love, of whatever, moving in a way that is for the benefit of someone or something or another. Ethical, we agreed on that it's essentially a set of principles. Now, of course, it can be, malevolent. Those can be malevolent or positive. So it's a pretty broad term. Although I think we both incline that we're like the way we're talking about it, meaning is like, is it ethically good? Like, is it more? It's sort of a stand-in, like positive assumption. I think we agreed on all those. And then the only one we didn't agree on was gender, where I was maintaining that the sort of old school 1474 to now definition, meaning essentially it's synonymous with sex. It is human beings uh, as male or female, man or woman, whatever, categorically.
Yeah, I'm with that. And I think one way I was actually a bit surprised in that pretty neutral framing of ethics. It's a set of principles that a group adheres to, right? So it could be
Yeah.
really any set of principles. And then I thought morality had a bit more judgment um, baked into it. Was that
Hmm.
your interpretation, or
Yeah,
is that standard?
I think both of them. I mean, I think it perhaps in philosophical circles, ethics may have be followed by the very strict definition. I would just say in terms of my own like use or observation of the use of the term, when people are talking about medical ethics, like, oh, well, was his conduct like in the surgery suite ethical? They don't mean was he sticking to a specific set of principles that he has not previously violated? You know, is
Right.
he being is he being a hypocrite or not? It means like is this according to proper ethics? So I feel like generally when we talk about that term in a social sense, as far as I can tell, I would say the majority of people use it to incline towards like proper, like it's a like it is good. So I think judgment is inherent to it. I think people,
Right.
like we talked about, like Nazis have a very consistent ideology that they largely stuck to. So we couldn't say they were unethical in that sense, in the strictest sense. But I think most people, if you asked were the Nazis ethical, people would just instinctively be like, no,
Right.
no, not at
So
all,
maybe
because
the aspiration there is that that social group adheres to something that's actually good for the common
yeah,
good of the social
yeah,
group.
yeah, that's caring or beneficial or whatnot. Which I
Yeah.
think adding something like care automatically like starts
Yep.
to incline it, kind of rolls it in that direction as well.
No, that's great. And I think we had talked a bit about love and truth,
Yeah.
which is probably its own 8-part series
Yeah,
on
for
this.
sure. Yeah.
Uh, and and then yeah, that brings us back to gender.
Yeah.
And brings us back to GEND. Sorry.
So that would be, yeah, my only question for us now is do we just go ahead and like move forward with a split kind of a split definition operating, and so we can just kind of bounce back and forth between those things? Or the question is, do we follow the executive order? Now, anyone tells me what to do, I'm less inclined to do it than normal. So, so that sort of speaks to my bias. So now that they've said it must be so, it makes me it makes it much less appetizing. But I have already previously stated my ethics as to the semantic use and semantic conservatism. So in order to be ethically consistent myself, I suppose I have to cleave to that one. Um, and
Well,
oh, and I guess the thing I never asked is you would certainly acknowledge that like it would certainly be false to say that gender is a social construct, period, or gender is an innate sense of things, period. But that would be one of the, and perhaps you would suggest the definition of primary concern in the question we're asking, as opposed to it's the primary definition, period, since that can be demonstrated to be inaccurate, meaning it's like the social construct
yeah.
aspects really don't even come in into the 1960s, which is about 500 years after the first use.
Yeah, I mean, I think semantically that's just objectively true, that it's a newer definition of the word. And my tendency, yeah, I'm not binary in this way, uh,
Yeah,
to say that, oh, just because even if we could like objectively prove that it was a better use of the word, which is in some
yeah,
debate between us and everybody, yeah, I don't see the need. Like dictionaries always have like almost every word there is has like multiple definitions, multiple
has
usages. We have an
has a list.
extremely complex and in various ways convoluted language. So,
We do.
um, and the concern here, of course, is that this attaches itself to very real policies.
Yeah, yeah,
The main question, just so we don't totally lose sight of it, is about gender affirming care. But then, in reading through even a summary of the executive order, this gets to things like, you know, do biological males get to be in women's prisons? And I think you've cited some evidence where
yeah.
rape does occur in some cases. And so, this that may be an extreme example. I don't know how common that is.
I think at
But
that point, we're really talking dozens, if not maybe hundreds
okay.
of men who are in women's prisons. It's not. I mean, it's way more than you'd think. I think my own brain would be like, oh, come on, that's happened like 3 or 4 times or something. It's way more than that. But it's not so much that you're like every prison you go to is going to have like men in the women's side. Um, it's much closer to the it's a relatively rare occurrence.
I guess that maybe that's a well, two things. One, yesterday for Martin Luther King Jr. Day, we my wife and I read Letter from a Birmingham Jail, which is
Mm,
an
yeah.
oldie but goodie. There's a lot of quotable thoughts in there, but one of them that stood out to me in the context of our discussion is that it says,
Yeah.
as Reinhold Niebuhr, uh, pronunciation uncertain, has reminded us, groups are more immoral than individuals.
Mm-hmm.
So this was rooted me in that framing too of just like what is it to make an individual choice, and so that's I guess been a lot of my framing in coming to this with like trans friends and saying, well, kind of what's the big deal? Like, can't we just let people be people? But the
Yeah.
bigger challenge here is around care and harm, right? Like, well, what's
Yeah.
allowed to
Yeah.
happen to children? We have all kinds of other stuff that protects children,
Yes. Yeah.
and then uh, the tone of that executive order was very much about protecting women,
Yeah.
and
That's become a popular thrust, and
yeah,
which makes sense
and I
in
don't
the
want
term
by any
sense.
stretch want to imply in my one kind of weak example that what is often put out that trans people are rapists or anything like that. That's ridiculous. And the question is broadly, what does it mean to protect groups of people and sort of honor their identities and in fact their hard-won protections and states of identities as well. In this case, women.
Yeah. 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 Right. Yeah. There will always be care trade-offs for anybody. Well, looking at care and ethics, are care and medical ethics evidenced in gender affirming care? So even if we hold on to it, like I would say gender affirming care is a misnomer, meaning the care generally speaks towards affirmation of gender rejection. So it's a gender denying care. Um, meaning as it's prescribed, because generally gender affirming care is you would then take the gender dysphoric condition and you would say that the stress and the dysphoria elements of it are because of the perceived incongruence, but it's not actually incongruent, and therefore you validate the the underlying belief that informs that stress. So anxiety and a lot of gender affirming care basically serves to um, really, I would say, address symptoms. So it really actually seeks to address anxiety, depression, suicidal ideation, that sort of stuff. Seems generally, in terms of the literature, that seems to be the metrics that they're looking to reduce. I've seen nothing in terms of reduction of identification as a gender that one isn't, which is central to the dysphoria. So this would be like, again, I've used anorexia often for this because I think it's the closest corollary. That would be like trying to address anorexia without really ever rejecting the appraisal of one's body as, let's say, too fat. Even if you're objectively like underweight, you can measure your BMI, your weight. You can do a body composition test. You can actually ascertain whether their assessment is accurate, just like you can with gender. Then, um, but the idea is to sort of help all the ancillary symptoms: suicidal ideation, anxiety, depression, etc., which are disproportionately high, about twice as high in anorexics as it is for trans-identifying persons, for example. So there's similar cohorts in that way. Is that how you understand gender affirming care generally, like as an overall phrase, or how it's been manifest?
Yeah, and it's such a good way to I guess carry this uh, duality through our conversation, right?
Yeah,
Because the very gender affirming immediately attaches itself to the idea that gender is fluid. So what you're affirming the identity, the deeply felt, gender
the claim. Yeah, you're supporting
alternate,
the claim or whatever. Yeah,
right? In the let's, I almost well like we need a term like well, what is it? It's the sometimes you'll say the novel definition. Maybe it's that's
yeah,
the novel definition is gender affirming, and the classical definition is gender denying because actually that person is denying their biological sex and
yeah.
um, and I don't know if that's 100% accurate because I don't I was thinking about this just within the last day. I don't know if I've ever heard anybody actually denying. their biological sex.
Mm,
In terms of saying, well, like say I wasn't born with a penis or something.
yeah.
And yet in every other way, saying, ah, I was born into the wrong body, basically.
Yeah, 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 yeah.
So
Okay, so it's
it's like
pretty,
gender denying is, I don't know, it's funny, it's like not quite, I know we don't need to get entangled on it, but it's like,
yeah, yeah, yeah.
even that's not quite right, but yeah.
Yeah, basically you're rejecting your membership as a member of your cohort. It'd be like a black person denying they're black.
Gender rejecting is closer, yes. Because you're not
Yeah.
denying that that's true, but you are saying, oh,
Yes.
I
Yeah.
don't.
You're denying said like the subjective appraisal of that which, at least according to consensus use, could be objectively assessed. And especially as speaks towards medical care, because this is really where it comes. It can, of course, be social, meaning it can happen in the home outside of a medical setting strictly. But especially as the laws are being addressed, but this applies all the way down to how one would interact with an individual basis. Um, what is the evidence for? Well, A, is evidence relevant? And B, what is the evidence for that as a socio-medical practice?
Was the evidence for it?
Yeah. So like why would you affirm and has it been shown to work, I guess, is the assessment metric. Or is that an appropriate assessment metric?
Hmm. Mine is purely anecdotal,
Yeah.
from friends. I've heard some touching stories where
Yeah.
it's like, wow, yeah, I finally feel like, especially post-op, like post-surgery, where it's like, oh, I had this feeling, like wow, like it was the first time I felt like, and even though it's, I don't know, like if you're not, especially if you're changing genitalia, it's not like it's the genitalia. I don't think we've mastered that operation, right, to the point where it's like exactly like the way you would be born into it. But nevertheless, I have heard stories where people say, "Wow, this was like the first breath I took in the right body," or something like that.
Yeah, yeah. Well, which is interesting, right? Because then genitalia is not a social construct. So then it definitely takes it. Once you get into, I mean, we've talked about this before, that there are sort of stages. Like you could validate someone's new name is like an earlier stage, or you could agree to their preferred pronouns, which have also been abolished, I guess, in our federal government as of, well, who knows how it's going to be challenged, but as of the executive order yesterday.
I'm
Um,
glad I already took them off my business cards. So
there you go. There you go.
when I give my papers, it'll be
Yeah,
good.
with your federal contracts. Uh, so then those are earlier stages, but once you get all the way to like hormones, especially like gender specific hormones, in that case it would be they're literally called cross gender hormone. Um, and then likewise, if you put a penis, like a fake penis on out of your flesh from your vagina, then you're actually addressing those are sex characteristics very specifically. In which case you are trying to biologically change your visible sex, I guess. So in that point, it's like this is the fascinating part to me. So this is sort of ethics as it. So then, ooh, is this ethical? Meaning, is that consistent, even semantically, in terms of ethical principle of like what we're saying these things mean? Because like, are we stretching past credulity to say that a penis is a social construct, like de facto, like in and of itself, you know?
I don't know if anybody would argue that that's a social construct.
So then, if you're changing that, to affirm your appraisal of the social construct or the system of ideas in which you exist, then it's not about ideas anymore. Once it's about material reality, you're altering the material. So then it's no longer the previous novel definition of gender isn't applicable. And this is you know what I'm saying? So, or do you see that as an inconsistent ethical assessment? Because you have to essentially sort of like go, oh, okay, well, yeah, but you have to do a bunch of yeah buts. It actually doesn't fit within the set
Well, that's
of
why I'm
even,
in favor of having sex
yeah,
mean biology and gender. Look, I mean, I'm as we've talked numerous times, I'm like sort of good with throwing out centuries of language and being like, yeah, let's try this. Um,
yeah,
and whatever they are, I think it's worth having two definitions. And then we talked quite a bit about, well, maybe it's just gender identity because that's clearer and you'd probably get less people fighting back because you're not trying to change a word, that's been in use for so long. Um,
Yeah.
so
Yeah.
I think I hear you because on the one hand, you're saying, oh, I'm changing my body to match my gender identity, with my social, my construct of gender identity. So to me, that it's you would need to, I guess, talk about both. Yeah, because if I catch your drift, it's like, yeah, you're addressing the biology. Um,
You're making material changes to literal sex characteristics.
right.
Those aren't those would be gender characteristics as well if you stick to the previous definition. But if you've left the previous definition, you're like, we're basing it on the second. It actually doesn't hold. It can't consistently hold up. You have to cross back over to the synonymous in order to even sort of discuss or appraise what's occurring. So at least to me, that's ethically inconsistent as far as I can tell. Now, what evidence is this? We can talk through this maybe just in terms of pop references, because I feel like that's what most people will have. Like, what are some arguments that you've seen or that have been popular, maybe in your cohort, in your community, online, whatever, in support of like why we should advocate for or join people in the realm of gender affirming care?
Well, I don't want to, like, are we generally talking about youth with that
Um,
question?
yeah, I mean, I think that's where it's been the loudest. But I think this, at least for me, I've seen the same arguments across all age ranges.
I mean, it's
I think it becomes a little more of like a libertarian. You just have a social difficulty in getting to apply it to adults, but ethically, there's no difference.
right.
If that makes any
Well,
sense.
and I don't have much to say about youth. I mean, I want to keep reading about it, but I can't think of a single time that I've heard anybody in my communities, especially trans adults, like advocating for, I mean, certainly advocating for less permanent, saying, let's see,
That's a good safety check.
like, for instance, at my stepdaughter's school, it's extremely, she literally came home yesterday and said a friend who was a little boy last week is now using she, her pronouns.
Yeah,
Um, so I think there's a lot of advocacy for that exploration, that just sort of fluid, hey, let's explore, let's see. Um,
yeah,
I have not, or maybe I missed it, ever heard anybody advocating in my cohorts for something more significant like hormone treatments and whatnot
yeah,
for youth. Um,
yeah,
so
yeah,
I feel like I don't have much to say about youth. Maybe we can talk about that more. Uh, my, probably slightly more than half-baked thought on that right now is, yeah, I'm against anything for young people that cannot be reversed, because I just feel like youth is a time for experimentation and um,
yeah.
trying
Trying on.
things.
Yeah,
And
absolutely.
yeah, um, so the question then, let's just say for adults who are choosing for themselves, so we removed sort of the challenge of assuming they have, full agency and development to make such choices.
Yeah,
Um, is gender affirming care ethical for them? I am still a yes to that. Um, and again, just to qualify, using the novel,
mhm,
the way
mhm.
that's framed, right,
Yeah,
begin with, is my understanding by progressives, which is to affirm, you know, the expressed identity of that person. Um,
yeah.
yeah, it's just, I guess I know too many people and I've heard too many stories, and it just seems like a bit tortuous, uh, to confine them or not let them move down that path.
What? So do you know people who haven't gone down that path then and are like, sort of, I guess, look back on that with regret?
I
Or
don't.
you're speaking people who have gone down that path and then they're saying they think it was a good progress.
Yeah, yeah. And in fairness, I mean, my trans friends are in the single digits, so it's not a huge
Yeah,
sample.
yeah.
Uh,
Well, yeah. I mean, it's not a gigantic community. So in some ways, most of the responses I've seen to the executive order are like, "Oh yeah, great. Let's deal with this," which has to do with like 0.8% of the population. Now, of
right.
course, you would have had to say the same thing when they first had introduced preferred pronouns and gender identity in an affirming sense. And I didn't see those same people talking about that, so I pretty much think they're hypocrites, is my best guess.
Oh,
Um,
you mean the progressives and like the people in favor of this are saying, "Oh, why are you picking
yeah,
that as your
yeah,
first
they're like, oh my
argument?"
gosh, this is like what a nonsensical thing. It's like barely anybody. Same thing happened with the women in fairness and women's sports bill that was I guess passed the House. I don't know if it passed the Senate, but it probably will, I suppose now. Is that people were like, why are you wasting this time on this little tiny thing? Um, so I've just seen that as an argument, and I think it's a ludicrous argument because you would have had to say the same thing when you introduce preferred pronouns or affirming gender identity. You would have to say, oh my gosh, why are we doing this? This is just a small percentage of people. The percentage of people has not changed so drastically as that protest wouldn't be similar. The argument I heard over and over again, so much so that I assumed it was true for quite a while, was essentially, do you want a trans kid or a dead kid? That if you don't affirm, then suicide is a likely option. And this was literally said by lawmakers, state lawmakers, and various as people debated through these issues. I saw it online hundreds of times. That essential thing being like, you're denying their existence, and people are going to die because of this. Um, that to me led me to go, well, gosh, that's a really extreme claim. Is that true? As far as I can tell, it is not accurate. There's, as I sent, I don't know, probably seven or eight studies, but I sent a bunch of uh, systematic surveys of evidence, which tend to be, at least for this type of question, are probably the highest we got. You can't really run an RCT on, in terms of hormone replacement and that sort of thing. People are going to know which group they're in. There's no way to blind it if you're affirming something or not affirming something. But there's a pretty massive study that found that like suicides were highest, that the suicide rate for trans-identifying individuals doubled after vaginoplasty, um, which is pretty significant. Um, so then that actually means like an affirming procedure increases just statistically. Doesn't mean it's going to happen. Some people may love it. The regret was that there's another study I read that the regret rates are less for these manner of surgeries, so sex change operations, than for knee replacements. Um, but we still are talking a suicide rate doubling. So there's a harm there, and one could say there's maybe a little lack of care there. We saw examples throughout the
And was
past.
that,
Go ahead.
is there an age group there? Was this?
Yeah, let me run back. That was, I'm assuming it's adults because it's vaginoplasty for kids is pretty rare.
Yeah, I
Uh,
would.
breast removal is not as rare as one might think, but uh, actual like removal. This is oh yeah, okay. So this is from the Journal of Urology, September 2021. Rates of psychiatric emergencies before and after gender affirming surgery. This is, let's see, this is maybe just over 1,000 patients total. It doesn't have, they're just from 2 years of observation before and after surgery, and it's just from data from the Office of Statewide Health Planning Development data sets,
Yeah,
emergency
it's
room codes. So it does
it's all
not,
good. Let's assume we're not talking about you. Yeah,
almost certainly adults.
yeah.
So at least with that particular one, you didn't, you have a significant, um, uh, uh, a significant increased risk of suicide remains essentially. So it doesn't really solve the suicide problem. I just want to say that for folks because I heard that one the most, and this whole idea that like gender affirming care saves lives in terms of stops people from committing suicide. It's really not. It's not the case. There's no strong case for that. And in fact, what has been found out in Finland, the UK, the Tavistock Clinic, where UK closed their Tavistock Clinic, which was the National Health Service providing gender affirming care for, I think, almost a decade. They closed that. They're like, we need to do another evidence review. Multiple countries have done evidence reviews, and pretty consistently. I mean, I would say this has to be the, as far as I can tell, it's the consensus is we don't know enough. Uh, we don't know enough to know if gender affirming care is helpful. So it's not. I also would say we don't know enough to say gender affirming care is certainly harmful either. For it to be advocated for, and it has been by like the American Psychological Association, a couple of associations here in the US, very out of step with the rest of the world and very out of step with the literature. Um, and a systematic review in child and adolescent mental health from a 1996 to 2019 in adolescents and young adults, it says that clinical gender dysphoria does not appear to be predictive of all-cause nor suicide mortality when psychiatric treatment history is accounted for. Meaning, once you factor in the coefficients of comorbidities of other mental illnesses, because it's gender dysphoria is rarely singularly diagnosed, then we don't actually have a grave concern. That a lot of the grave concerns happen to be rooted in comorbidity, um, uh, depression, anxiety, that sort of thing. Actually, even more so than just simply being trans. And so this is one of the first studies I saw that was pretty sizable, and it's a big study from whatever, like 25 years. So it's, we don't have a ton of huge data sets on this. So a lot of it is conjectural. But what we have seen is, for some reason in the United States more than anywhere else, perhaps because of our affections for individual freedom or individual agency, has gone way farther than pretty much anywhere else in the world in terms of the claims that they're making. Across the board. And that has descended into, like I sent you that MIT piece where it was like whatever, the history of gender is shorter than, is more recent than you think. And it was a MIT published in MIT, and the whole thing is a gaslight saying that gender basically wasn't invented as a term until the 1960s with Dr. John Money, which is just not remotely, I mean, it's just factually inaccurate. They're literally off by like 500 years. So I've noticed though that like these false claims have piled on top of each other, and that's one of the things that first made me really kind of suspicious and or curious about this entire endeavor. But also, I think maybe let me ask you this question. I find that like the more popular fake arguments I can uncover on any particular side, which each one I find, it increases the likelihood in my mind of the unlikelihood of their premise being true. And that's not entirely fair. You know what I mean? That's a little bit like judging a coin flip. But does that make rational sense to you?
Maybe as a way to feed into that question, I just, as my mother-in-law would say, I Googled it up. What is gender affirming care?
Yeah.
Did I say stepmother? Mother-in-law. Oof, I need more coffee. Uh, Gender affirming care is a range of medical, mental health, and social interventions that help transgender and non-binary people live as their true selves. It's designed to support people whose gender identity differs from the gender they were assigned at birth. This is
Mm,
the Google AI overview.
yeah.
So
Which is,
that's fascinating because that's the
yeah.
AI somehow found a way to like talk to both sides. Because on the one side it's saying true selves, and the other side it's saying gender identity differing from the gender they were assigned at birth, basically synonymous with sex.
Yes. Yes. Well, and again, that's that loophole with assigned, which of course relates to the sort of relative concept as well, because we're in the realm of we're talking about socio medical treatment, right? This is all like treatment for care for improvement of a person. By In which case, like having evidence would seem enormously relevant because you'd have to be able to, you can't just say you're helping someone unless there's evidence like of aid, of actual help being administered. You know what I mean? And so what would that help be, right? If it's not a decrease in like let's say suicidality. Um, what is it helping? And then the problem is there too is like assign if you're saying assigned, and if you go from a relativist sense, then any this is we run into a problem where, and this is to me, this is a little bit like you're a racist. If you say you're not a racist, that proves you're a racist. It's like a fake checkmate from the beginning, because if you don't if you don't validate this, then a you're immediately sort of hateful, but at the same time, you're saying this is just like an assignation that a doctor made, which means then that any doctor conducting a study using as objective means as you can with sort of subject things you're going to have to do survey questions and you'll look at it codes on or whatever. Those are all just assigns. Those are all assignments. That means a doctor telling you you have stage 4 cancer, that's an assignation. He's looked at evidence to he or she has looked at evidence, right, to then proclaim that end. But if you're dealing from a completely relativist sense, then the patient is not only like an arbiter of what is wrong with them, but they are the ultimate arbiter. Now that's true of a patient, right? You can decide how to treat cancer or not. But is it as valid to say that a person's own diagnosis, let's say with no evidence, except just a strong, firmly, a consistent, strong, firmly held belief or even self-knowledge, versus someone being like, well, but here's a study on what levels are associated. Here's your blood tests, and there's all the levels we see that are associated with these consistent observations of cancer diagnosis. Plus, here's a MRI of the cancer. Plus, here's the blood. I mean, you can show them all the evidence. So then actually in some ways it makes it, this is again like this is where it gets into a Gordian knot of like, well, how do you behave ethically in that situation at all? Right? I don't think there's a consistent way to be ethical, because you basically it appears to keep carving out these special exceptions that were like gender means this, well, except for the people who don't think that it means that because that doesn't apply to them, then we have to carve out a special exception out of that, even though that's really not how, that's not consensus, that's not communitarian. And then you have to do it in terms of medical evidence as well, because you're like, well, that's just the assignation of a doctor, just like my gender was. And then so you're like, you get stuck in a way where like all you have is subjective, like you've at some point, like you've talked about, you get rid of all objective anything being meritorious, which means how do you ever show it to be like it can only be good then? Or it can only be good or bad depending on the person who says it. Who, like the individual person who's receiving the treatment. But that doesn't seem like why would we suddenly start doing that for this one particular thing? I guess is my big question. Where it
Well,
seems like
certainly
I don't think we do it anywhere else.
if the definition of ethics is about agreed upon principles or code,
Yeah.
it's that necessitates some shared language, right? Um, what I keep wondering about, and I think this is related, is I mean, let's just take pronouns
Yeah.
for elementary school kids. It's it's astonishing to me, actually, as somebody who's, very much been on the progressive side of this for years. It's astonishing to me how many kids just pick different pronouns,
Yeah.
and it just makes me wonder. And I think this is related to your point. It makes me wonder, is that because we've made it so prevalent? Would they be just as likely to experiment with, I don't know, I can't think of a good example. Some
Anorexia is the most popular one, meaning we've seen social surges in both of these conditions, and they're both body dysmorphic. It was like the 2010s, I think, early 2010s. There was some like crazy, whatever, like 192% rise in anorexia as these online, especially online, these like online communities, the Anna community, the Anna and is it Mia? Anna and Mia for anorexia and bulimia. So they kind of like became, it helped commodify it. Well, and you would assume because of this, we've talked about this too, that the social prevalence of progressivism in your particular community, that to identify as other than, non-binary, et cetera, it immediately moves you up the caste system. So for kids, it makes a ton of sense
Yeah, I
as
mean,
like you can advance in it's like that it's like what used to be passing for white whatever in the 1950s. If you could pass for white, then you moved up the social caste system. Now if you can identify as non-binary or trans or whatever, you move up the social caste system and you become a more valuable member of that community.
yeah, I one thing that's coming up for me is like having long hair as a guy,
Yeah.
which seems oddly relevant since that's generally seen as a feminine trait in our society, I think still. Uh, and I experimented with that in high school.
Yeah.
Um, yeah, I don't know. I'm just, it seems it's hard for me to believe that every kid expressing themselves, with different gender identities, is going to stick with that for the long term.
Yeah. And
So,
if it's
so
flexible, then is it, yeah. I guess what, so then you're taking a static category and making it like eminently malleable, which I think where a lot of this is why so much of the stuff is about language.
So if we just take that, maybe that one dial into that one thing. So for these
Yeah.
kids, it's pronoun usage, it's experimenting with different gender identities. I think we can agree on that terminology for this purpose.
Yeah.
Um, so we could say gender affirming care in that sense is stated to mean, I'm going to call you by your new pronouns. I'm going to support you in
Yes.
this.
In your claim. Yeah. Even it can be, but this is the problem though. This is where we run into. Is it caring or ethical to validate someone in something that could be proven not to be so?
Right. So that's why I raise it. It
Yeah.
seems to
Yeah.
dial right
Yeah.
in, maybe a
Yeah. To that
simpler
thing. Yeah.
example than some of the others.
Yeah. Like if someone, for example, you grew your hair out long in high school and someone was like, oh, that makes you a girl. So now you're a she, her. Just one person's subjective claim, but they know it in themselves that if you grow your hair long, that means you're a girl. So from then on, we're affirming that you're a girl. Because it's somewhat random to just like assign and well, you say, like I say, you say, whatever. It can be anybody. We're just talking about one, the whole basis is one individual subjective claim overrules is to be validated, whether it can be validated or not. You know what I'm saying? Like, can it be validated in order to be validated? Like you
Well,
could
there was a
validate,
micro
yeah,
adjustment even in
yeah,
that, unless probably a
yeah,
couple of years that I
yeah,
noticed. Frankly, before I kind of tuned out of some of these groups that were totally like religious about it,
yeah,
which was preferred pronouns got on the
yes,
got on the woke naughty list.
yeah, yeah,
And it was like, no, 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 don't say preferred because that's diminishing the truth of their pronoun
yeah,
usage.
yeah. So that's what they're making. So then they're making, this is why everyone disagrees on these things, because then they're making a truth claim. The kid who's saying, I'm a she, her. So then, and that's not even in there. That's not even in Merriam-Webster. What she, her, like, that's you're then so then you're not this is this cascading effect. So if you change what gender means, then you're also changing what she her means, what he she means, what they, I mean you're altering a domino effect of what language is. And so you're actually teaching and then you're teaching kids, hey, maybe a valuable lesson on the relativistic, gradations of semantic reality. But also you're saying it's also the emperor's new clothes. You're teaching kids the opposite of the emperor's new clothes, which is because kids have been punished for this, right? We know plenty of circumstances where kids were sent home because they wore a shirt that said there are only two genders, or there have been teachers who've been suspended for not using a child's newly, freshly claimed pronoun. So it's already authoritarian. It's already contrary to like semantic evidence that what you're saying is accurate. So are you validating something that is untrue? Like, it, do we have a means by which you can assess something as inaccurate? Because right now, even if it changes later, showing that it wasn't a consistent truth claim about your identity, then that doesn't within the construct, it doesn't that doesn't even validate it. So to say something was true and then later say it, no, it isn't true now, that's not an invalidation. In which case, do you then are you painting yourself into a corner where you can actually never assess harm? In which case, that's an unfair system of figuring out whether we've loved someone properly or not. Does that make sense?
I think so. To me, the answer is in this example is something around well, we're going to hold this as a as an experiment. Like kids might experiment with anything else.
Yeah.
And I that probably collides with your, you know, semantic conservatism, where it's like, okay, yeah, I get it. You experiment more with, as we've discussed, you Brendan experiment more with your look and your fashion and your all sorts of things than I do and most people I know actually.
Yeah.
Um, but you're not like changing the definition of words to do so.
Yeah, I mean, or something. Listen, you can demand other people call you by new names. I tried it, in my childhood or whatever, and then most people didn't do it, and then you're just like, oh, all right, well, okay, um, there you go, and it bums you out, but like whatever, and then maybe it would feel better. You feel more powerful essentially if you could dictate reality to other people.
I think
Um,
there's something to say, yeah, that's part of it. Yeah.
Yeah, yeah. So then it's a power move. It's a move at a, you're experimenting with colonization, being a colonizer. Um, but the thing is like just as a whatever an 8-year-old is like, I'm a dinosaur. They're like, cool. What's up, T-Rex? You have fun with it. Nothing wrong. I don't think there's anything wrong with like an essential, joyful, like, oh, let's play. But when a kid makes a claim on a serious level, isn't it careful, most ethical, most loving to appraise that, assess, and see if that's a true thing? So, like, if your daughter was like, I'm super fat, right? And I know I am. I don't care what you say. I know I am. And you'll be like, well, okay, well, sure, we all got a little maybe body fat we can lose, but we can actually look at that and assess that and figure that out, right? You could take someone to a doctor and be like, hey, will you examine her? Will you measure those things and find out if this is accurate or not? Just I mean, to affirm the claim, even from a genuine sense, as opposed to affirm it as a, is that even affirmation to just agree with something with no knowledge of it? You know what I mean? Or are we getting to the realms of you've abandoned morality in a collective sense? As an individual, you've then submitted to this sort of collective concept and then actually divorce yourself from moral agency. Because to validate someone in something that is inaccurate doesn't appear, it would be a harder, I would just say it's a harder case to make that would be loving or therefore careful, if that makes sense.
Yeah. I mean, it's fascinating. I just, I'm very comfortable, I guess, holding this layer of gender identity on top of biological sex. And I'm okay with that layer being experimental, probably especially for kids. And I'm contemplating in this moment, like, my daughter's never come home and said that. So I'm like, I'm glad we're having these conversations and going this deep because,
Yeah, yeah.
I mean, 3 years ago, I wouldn't have, I've been like, oh, great, you're whatever now. I mean, actually, this is closer to home. I mean, my niece is they, them now. And
Or is she, is the question. That's what I'm saying, right? Let's
she's,
just evaluate as a truth claim generally. She either is or she is or she isn't. So is she?
they have,
So is
they,
she?
she have stated a request to be referred to by they, them
Right.
pronouns.
Would that be accurate? Is what I'm saying. How do we assess that within within that cohort, within that format? Um,
Well,
how do
they,
we?
them, aside from, I mean, once you kind of get over the grammar challenge of that depluralization,
Yeah.
okay, on the one hand, it's the hardest to transition. I mean, if you've known somebody, especially I think for a parent, right, who
Yeah.
wiped, whatever, changed diapers and all that, is was confronted with the biology of their child, for long, many years.
Yeah.
It's a real tough mental hack, really, really tough.
Well, and but how do you just figure out whether it's true or not? Is all I'm saying.
So there's that. And
Yeah.
so what I'm
Yeah.
saying
Yeah.
is, weirdly, I don't know what they them means as truth. So in a weird way, it's
It
almost
means
safer ground. It's almost safer ground than choosing the opposite binary of sex or gender because they them is it's obscure. I mean it's non-binary, I guess. So in a sense, like it's untrue in the sense of like, well, it's as true as any other gender identity could that one might claim if we agree with that construct, which I know you don't. It's not true in the sense that aside maybe from some very obscure cases of asexuality and other sort of medical cases, I mean, everybody has a sex, a biological sex.
yeah.
So
Yeah. So if you're saying you aren't in either one of those groups, that would be false. Because, well, at this point, we're even just like, I think this is the difficulty is there's no working definition even of this application of gender. So this makes it extremely difficult, meaning because it stems from the 1965 thing saying the sort of social mores and stuff associated with said cohort. So the claim that she is making is that she is no longer, her pronouns aren't she, and pronouns are for other people. So that's not her personal dictation. That's not how she refers to herself. That's how other people refer to her. So that's her telling other people to do something that is based on it, like it has a meaning, and it's rejecting other things that also have meaning. So this is the difficulty. Like I would say it's unloving to validate her in unreality. Unless again you're working in a very, to me it's just wildly unsafe, um, because it makes even like whatever biological claims or social claims um, uh, fluid, which means that's an endlessly manipulatable. It already is it's post manipulated, but it's an eminently manipulatable system for you to appraise anything, which basically just means whoever's the most powerful wins always. It turns it into an oppressor oppressed dynamic where it doesn't have to be. Because again,
yeah,
like science or reality or like, being able to like evidence something via like an evidence-based or argument-based or rational-based thing is a tool to protect the oppressed from the oppressor. So
yeah.
when you remove that, like what's yeah, I was like, so how do you validate that like in love? Like how is that working for the best in that person without a comprehensive like medical or psychological framework in place going, okay, we're going to try this experiment. It's so crazy. I mean, yeah, the idea is it's so crazy it just might work.
Non-binary, I think, is the lesser, least common, form of expressing a different gender identity than your sex.
Yeah.
And it always makes me, I guess, the underlying curiosity I have, and I really wish these conversations would get to a deeper space. And so two things come out. So one with my
Yeah.
niece is, well, the loving thing is to talk to her about it,
Yeah. Oh,
talk to them
absolutely.
about it, and just
Yeah.
say, wow, cool. How did this come about? Just, just learn like where they're
Yeah.
coming from and why. And I don't know. And they're 13, so they're, I mean, it's peak puberty and exploring all sorts of biological changes and sexuality and everything else, I assume. But that's my first one is like, well, like anything, how do you love is like actually learning about them specifically. um,
Yeah.
the other part for me is and we've touched on this very lightly, but I feel like what would lead somebody, it's I guess it's more, if there's logic here or some sense of clarity, it's that it's, and this is more common, so maybe this is true, but it's more likely that somebody will sort of pronounce the other gender, the other sex, as you know
Mhm.
what I mean. They'll go for the other part of the binary.
Yeah.
This rejection of it all, makes me wonder, gosh, is there something deeper here about um and in the just a rejection of all the social norms that tend to accompany that sex or
Right.
the expectations.
Which means in that case, if that's, I was thinking that too. If that's the case, then they're rejecting your novel definition of gender. They're going back to the 1965 one, which is I'm rejecting these social categories associated with these two genders. So that's the fascinating thing. That's not compatible. So that can't be if it can't be rationally compatible, it can't be ethically compatible. So that's not compatible. And I think that too. I mean, I agree that that's part of what's going on, but that's rejecting that's unethical in the strictest sense, meaning it's an inconsistent, unless your ethical principle is pure relativism, I guess, whatever I say is true, but then essentially you're just making yourself God, which feels like the preeminent ethical wrong according to all philosophical, whatever the majority of philosophical and religious thought, which is like everyone's like, no, like let go of that. Like if nothing else, right, release your attachment from the ideas that you have about yourself. Um, so it becomes very difficult. And it also becomes difficult too because what is that we have no precedent for this. And I think that's my curiosity is like if she came to you and it's like, yeah, I'm going to fat camp this summer. She doesn't need to go. I'm not commenting on her body to objectify her, but she doesn't need to go to a fat camp. You know what I mean? I'm sure, listen, we can all be healthier. I can be healthier. You can be healthier. We can all be healthier. But it would be odd for her to claim that she's like morbidly obese and needs to be. And people need to like say that and don't say anything. Like you just need to validate that. You can explore that. Absolutely. Those questions, I think, are the vital things, like you're saying. Approach someone, be like, okay, well, why? Why are you, how did you come to this? What are you thinking? What is it? What does that even mean? You know, that sort of thing. Um, but in making that assessment, you do then have to appraise, wait, do I agree with her assessment or not? And it's not consistent in terms of what gender, the novel definition of gender identity. It has to jump over to the other one, which rejects, which is those are incompatible definitions. They can't really, they can coexist. I mean, they both exist in the world, but they're not. One says your long hair doesn't make you girl-like. It just adds long hair statistically to the male side of things in terms of analyzing what our social mores, because that's how we identify what any social more is, or like gender role is. It's just like what is repeated often enough to become prevalent. Looking at it just from like a data, or even just the way human beings assess, we assess it in a data-like way as well. It's just how many times you encounter in an argument or a blah 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 or a position on something. So she makes a great case, right? Because in some ways it's a softer run, but I don't think it could be considered ethical care to validate that because it can't be ethically. How could it be ethically consistent across other representations of principle? Meaning, if she ever said something untrue about herself, like, well, you know what, I realize I'm going to a black camp this summer, and I'm making this all about summer camp, but I'm going to a fat camp, even though I'm not fat. But I'm going to, and I need you to validate me in fat camp and help me, affirm me. And then, likewise, I'm black now. She's not black, um, but I'm black now, right? Which is certainly a social construct, right? Or more certainly, I think, as people, I think there are biological tethers that are relevant, but they're not enormously relevant. So that's a lesser claim. But as I'm assuming, everyone in her family will go, okay, well, why do you think of yourself as black? And then by the end of it, you're like, oh, okay, well, it's interesting. I'm glad to hear your perspective. But would you validate her in her claim to be black? You probably wouldn't, just because you're like, well, that's not loving to like agree with you about something that's not true. You don't stop loving that person, obviously. And you might maybe you only assert it periodically that the emperor is wearing no clothes, that she's not actually black, she's not actually fat, she's not actually not male or female. So yes, that's sort of my question is like, how do we even just this using this test case, how do we validate that? Um, how do we appraise that as accurate or inaccurate, loving or unloving?
Yeah, and that's when I have to look at the novel definition and say it is accurate in the sense of gender identity, which is fluid and can be chosen. Um,
Well, what is it? Well, hold on a second. What does that mean though? Like, what are you actually choosing? Like, what is it
uh,
that's being chosen?
well, how to express oneself. So I think that, and this is why like preferred was sort of stricken, right? Is like, oh no, we need to emphasize. Most purists would say, no, I'm not choosing this. This is my state. Like I was essentially,
Yes, which I appreciate because then it's a truth claim that you can argue against or not. Yeah. Yeah.
the choice then I think is the expression, like say pronouns or an example, an example,
Hmm.
which sort of I thought the preferred pronouns thing was just yeah, a little over. I don't know. The movement jumped the shark a bit on that because it's like, well, even if you're a purist and you say no, like it's absolutely true that this person like was has a gender identity that's the opposite of what they were born into. Um, there's still a choice to be made. Like what? Oh, how do I want to
Yes.
express? Some people choose different names, right? Some people
Yeah.
like choose pronouns, so there's still a choice to be made in that.
Yeah. Yeah. And some people change not. I mean, if you are that thing, then it requires no affirmation for that thing to continue to strongly be true. Also, I mean,
Right.
you can be affirmed in you could affirm it by proclaiming not by proclaiming nothing. You could sort of self-affirm as well. But I think that's my confusion too, because there isn't a definition. Then it's like it's essentially your gender identity is kind of like, hey, whatever you identify as is cool. But still the confusion, the deep confusion becomes, wait, what are you identifying as? So if
Well,
you're
and we got to come back
yeah,
to the word ethical because
yeah,
it's not by any stretch like within a set of norms, like principles and norms.
yeah,
So I think that's
yeah,
I even after 3 episodes, I don't know that we're going to have crystal clarity coming out of this because on the
yeah,
one hand, it's like if a strict definition of ethics is about agreed upon, norms, or a softer definition, as we said in the beginning, is about, you know, reducing harm or common good.
yeah,
Um,
yeah.
you know, it's not clear here. As you said, even in the surveys, we probably have a lot more work to do to try to, find evidence of what's true and not. Um, so I don't know. This could lead us to try to answer the question:
Yeah.
is this is this our moment?
Yeah,
Um,
yeah. So then what's the yeah, I would just say do you have a summary like sort of statement for why what your conclusion is? Or if you want to think about it, I have one and I can just say it out loud
well, yeah, go
as my
first.
conclusion. Okay. So I even wrote this down because I was like, I can pontificate too long. Okay. So to summarize, here's how I understand it. Using a definition of gender that is brand new and contrary to consensus of use historically and presently, a medical approach that is not supported by scientific evidence was popularized on popular false pretenses with a widespread vilification of those who opposed it. And that approach was to validate the conclusions of those with a recognized mental illness as reality, in contradiction to evidence that those conclusions are real. So I have to say that gender affirming care, in as much as it exists, is not ethical because for by all those things, those are all like little bumps against the edges of ethics. And then, as far as I can tell, even in terms of internal consistency, it's not holding to an ethic at all. Like it's actually abandoned ethics as a concept. So I think it's both in terms of relativistic ethics, it doesn't actually stand up because it's like, okay, what's your internal code? And it doesn't actually, it's not consistent, so that's not ethical. And then it's not of ethical good because there's no evidence of benefit, and it's very clear evidence of at least risking harm because anytime you validate a falsehood, you're perpetrating a harm. When you do it out loud in front of other people, you're harming yourself and everyone else. And the whole pushback, it's even undone by the whole pushback against trying to say gender affirming care is wrong. People are saying, no, you're wrong, right? No, you're wrong. You're causing harm if you don't let us do this. In which case, you've then reintroduced it to the realm of we need to have objective evidence as part of this assessment, or else that's the end of the argument. You're wrong. No, you're wrong. Does that make sense?
Yeah, it's concise. Uh, for me, and I don't know if you want to answer this part, but we had tagged
Yeah.
on like ethical and or loving,
Yeah. Yeah.
which I assume is maybe the same answer for you.
Yeah. I would say it's hateful. It would be hateful to validate something in someone in something that is not true, and especially to then go anywhere further down the road with them in validating that which is inaccurate. The same way I'd say it was hateful to to agree with your anorexic daughter that she's a fat bitch, because it's the same principle. I just cannot find any other like demonstrable delusion where anyone is willing to dive into the waters and start redefining things across the board in order to somehow make the square peg fit a round hole. So I don't even understand where the fervor comes from. That part's very confusing to me. That's a separate conversation. But yeah, I would say it's unloving or even hateful, is working towards that which is to the detriment of someone else. Now, if you have to do it in an emergency experience, right? You talked about your dad being like, I'm in the garage right now and I can't find anything. Like he's not in the garage. And you were like, okay, dad, well, I'll help you look for it. Because you know what? He's in essentially like in a delusional manic episode. if you're trying to get someone through an emergency experience, do you just go, okay, hey, she just needs some help right now? Do you validate someone in an emergency, like a full-on emergency scenario? When I say that's unloving or unethical, I think you have a way better case in an emergency scenario where someone's about to cut their wrist or cut their throat or whatever. You're trying to prevent literal active harm. But validating some, like if you just every time you went, you were just like, Dad, how's the garage? And you just let him live in the fantasy world of his garage thing. Because no, unless you're going to convince everyone else to also lie to him, then all that's going to do is serve to his detriment. Because his nurses are going to come in and be like, Mr. Swindler, you're not at home, darling. You're here right now. We're actually above. And they'll tell him the address again or the name of the facility. You know what I mean? You're actually kind of working against what everyone already has the ability to assess and recognize, right? And this is why conservatism makes some sense because you're like, well, wait, why would you disrupt with a thing that's not accurate in order to potentially, it's possible. I mean, you could do it. You'd have to have an all staff meeting about it. Um, but I think it's more tentatively hateful.
You know, I mean, to me, a lot of this boils down to agency,
Yeah.
so I don't know. For instance, I'm in favor of euthanasia, if somebody wants that for themselves. Um, so yeah, I feel like I would split this up a couple ways. One is plus like gender affirming care, aside from even the language having various interpretations, means so many different things, So it's such a broad question. So it's to me, it's ethical in the sense that if somebody uh, wants that for themselves, let's say an adult wants that for themselves and uh, wants to express themselves a certain way, modify their body, whatever. Uh, to me, it's ethical to honor their agency.
No matter what, like no matter what they want to do to their body, like they want to cut their tongue off on national television. They want to get on the Gong Show. I know the Gong Show doesn't exist. I don't know why I thought of that. I've never even watched the Gong Show, but they want to get on public television. They want to cut their tongue off because that's just kind of how they want to
Well,
express themselves or whatever. They want to
well,
cut
let's
things
keep it
off,
within
do
the
drugs.
realm of gender affirming care
Okay, yeah. So
to the
yeah,
extent we even know what that is.
they want to. Yeah. Well, I guess in that case, they want to. Um, what would be anything that would require any like difficulty? Yeah, I guess that they would want to start injecting drugs that will fundamentally change their natural physiognomy, or they want to hack parts off of their body. So that just as general categories that apply specifically here, but of course
Yeah.
that's a multi-category application of like if someone wants to start shooting heroin or whatever, you'd be like, well, it's ethical for me to support you in that or whatever.
Well, yeah, that's a good example. Like people, they don't let drug users into like uh, houseless shelters and stuff, and
Yeah,
I think that's a problem. Because we're not actually addressing the deeper challenge with that addiction. And I realize
yeah,
as I say that, you're like, yeah, and we're not addressing your perspective, the deeper challenge with this delusion of reality in the sense of gender affirming.
yeah,
I
yeah,
think the it's given me a lot to think about in the context of what does this word ethical mean.
yeah,
Let's the Google definition aside, which hey, let's face it, Google probably has a pretty massive influence on changing perspectives in terms of language and social norms. I think we've accelerated that probably in a lot of ways. But even that aside, what I just typed in for gender affirming care, I don't believe that this is by any stretch the norm. Um,
sure.
and so, in that strict definition of ethics, I would say it is not ethical because it's a new way of being and talking and validating each other that's trying to emerge.
Yeah,
So that's I don't know. Those are I'm holding some conflict there between my fervor for agency and supporting that
sure.
as a fundamental tenet of ethics, as well as the idea that these are not social norms. I don't think anybody could
Yeah,
argue that these are social norms yet.
yeah, yeah. And well, and the question is it even internally ethically consistent? Yeah, in terms of the internal ethic, right? In terms of any system of thought, like as far as I can tell from our conversation, it can't. You have to keep leapfrogging out of the ethical boundaries of it in order to validate it, right? In order for an ethic to be established, there has to be principles that are applied across multiple manifestations, right? And I think the hard thing would be, although I think in the progressive set, I think it's less hypocritical than people might accuse it of, because like, let's say aiding and abetting um, drug use, I think is very similar category where people are like, that's why would you give people the tools, the cleaner tools by which they continue to harm themselves, you
Right.
know?
We need to
Like,
get a
so
clean needle so you don't
yeah,
get HIV or something. But yeah,
yeah. So you're participating in harm in hopes of averting other harm. You
right.
might call them greater harms, lesser harms, who knows? Um, so in which case that can be at least consistent. But yeah, that's I think that's the area I hadn't even really considered. I think I was like, oh, well, internally I'm sure it makes sense. But I was like, oh, internally I don't think it's ethically consistent. It's actually proposing a brand new system of ethics for this particular delusion or this dysphoria only. I haven't been able to find any corollaries. No one does this with anything else. And that's my big weird curiosity, like why is, we all live in a society where transracialism is more controversial than transgenderism. That doesn't make a lick of sense based on our consensus of understanding as to what race is. So you're like, so that's there's an inconsistent ethic being applied internally as well as it's not. Of course, it's absolutely unethical by like a previous or classical or society-wide framing.
Yeah, and I mean for me, loving is sort of equally fraught or challenged to answer. My instinct is like yes, it just because it just feels loving
Yeah.
to to affirm someone's self-expression. I mean, cold stop, full stop. But at the same time, I associate love with truth. And so,
Yeah, yeah.
like I was saying with my niece, it's like, well, I would actually want to have a conversation and, you know, I mean, I don't know, not like force them to use my framework, but hope, I guess, that they're kind of still understanding these distinctions and kind of learn where that expression exists in this big matrix we've explored here of language and human reality. Um, and make, because it's to the extent that it's, I don't know, like, I don't know, something like innocent expression or experimentation. It feels like that nurturing that quite generally, especially with children, is very valuable. Um, and if it's denying something that's true, that's potentially harmful.
Yeah, yeah, yeah. That's definitely that's a tricky crux.
Yeah. So that's where I'm landing.
Okay. Well, I think those are good end notes in general is hey, talk to people. If people have an expression, there's no need to immediately reject it. There's no need to immediately affirm it. Approach with curiosity. Ask it. Inquire. And don't stop talking about this, folks. Let's not let people like the president turn this into this is what we over here believe, and that's what you over there believe. Let's all stay open and talk and examine these things and try to figure them out.
That's what we're about here on Totally Classic.
We're here. We're here for
Love
each
you.
other. Let's do it. Love you, man.
I love you and your truth.
I don't believe in my truth, but I love you very much.
Bye.
Bye, buddy.